Welcome everyone to this first Health Echo. It's wonderful to see so many people and from all over the world. A number of us attended the ECHO Institute in New Mexico some months ago to learn about this ECHO project, which was started in America to try and improve care to people in the first instance with hepatitis C. And they realized that they could use Zoom technology to develop communities of good practice, initially in the state of New Mexico, then subsequently across America itself. And now many of you may be part of ECHO programs that have really been established across the world, particularly, for example, in India, where it's become a very key part of providing care to people with a whole range of conditions. We are the second rare disease organization to seek to use ECHO to try and, again, develop communities of good practice across the world. The first organization was the Ehlers-Danlos syndrome, and we have been greatly supported by them and learned a lot from them. But we are still ourselves are learning. So we want to hear from you all the time about how this works and whether we could do things better. But really the key principles are set out on this slide. Firstly, in the case particularly of people with Prader-Willi syndrome, it's about developing an understanding of the holistic care of people with Prader-Willi syndrome. And we recognize that you all have very busy jobs to do, but we would encourage you to try and attend all the sessions if you can, even if they're on a topic that may not be directly relevant to you. Because I think our experiences across the world that people of a particular discipline may have to deal with a whole range of issues that come their way when they see people with Prader-Willi syndrome clinically. Second, I think very important point here is this term, all teach, all learn. It is about us learning from each other, giving our wisdom and understanding and our experience for others to learn from us. So it's very much an exchange. So we would encourage you to contribute to the discussions, particularly to the case discussions that take place in the second part of the program. And just to say, as far as those discussions are concerned, they may be around a clinical topic, which is obviously anonymized, but someone you're seeing that you're struggling with, or it may be around a particular issue in your country, as will be illustrated when we come to Esther's talk about Kenya. And I think the third point here is that we are trying to build a Prader-Willi health community so that you can call upon each other for guidance, for advice, maybe for research collaborations, and so on. This is particularly important for any rare disorder where there is relatively small number of people who will see a lot of people with Prader-Willi syndrome. Most clinicians might only see a small number, and therefore it's difficult for them to develop the necessary expertise. The core principles are stated here as in the form of ABCD, so amplification, so using technology, and this was well before the COVID epidemic. So the ECHO Institute were way ahead of its time in using technology, Zoom technology, in order to make the best of the scarce expertise that is available across the world. Secondly, is to share best practice in order to reduce the health disparities, in this case of people with Prader-Willi syndrome across the world. And at IPSWO, we're very well aware that there are countries that have wonderful services for people with Prader-Willi syndrome, and there are other countries that have very little services or in which they don't even know the people with Prader-Willi syndrome in their country. And then to apply what's called as case-based learning to master complexity. So this is what I mentioned earlier about sharing ideas, bringing cases to the group to discuss. And finally, to evaluate and monitor our outcomes. And this is using database and technologies developed by the ECHO Institute so that we get some idea of how this ECHO has worked and how we can improve it and develop it further in the future.